Thank you. Good morning, everyone. I'm from Tumours UK. So we are the charity in the UK. We cover the whole of the 4 nations, Northern Ireland, Scotland, England and Wales. And we provide medical support by way of a network that comprises community-based nurses, a national helpline. We run information days in areas where there aren't any nurses, and we provide leaflets and literature. They are not written by non-medical people. They are all written by my specialist nurses and approved by our medical advisory board. So the first couple of slides are just background, because not being a member, I thought you might like to see some information. It costs approximately £500,000 sterling a year to run this. So we've had a bit of a dodgy year with COVID, but we've managed to ride out the storm and looking forward to hopefully better times next year. Now, as you can see from the map, not all of the UK is covered. When I actually started about 10 years ago, there was only 2 nurses. So this is actually quite an achievement. It grieves me to say it takes approximately 2 years when working with the National Health Service in the UK to replace a nurse if they leave. And I'm just about to announce a post in January that's actually taken me just short of 4 years to find an authority to work with us. So it's not that we don't want to set up these nurses posts. It's actually convincing the respective health services to work with us to do this. Now, each of my nurses, they're coloured in by the various geographical regions. Each of them supports between 500 and 3,550 families, which is quite a huge caseload. They provide medical support in terms of clinics, either face-to-face, telephone, or nowadays virtual. Although we do know virtual is not wonderful as everyone seems to think it is, because an awful large number of people with NF, because research shows that by the time you're down to family level 3, you're in the lowest socioeconomic group. An awful lot of people don't have access to broadband services. So we know over the pandemic, yes, there has been people that virtual clinics have worked for, but we know there's an awful lot of people that we haven't been able to see because they don't have access to facilities. A large part of our work is around school visits, and I gather a lot of you are parents, so I will talk more about those in a minute. We do home visits. Because of the nature of the condition, an awful lot of people are isolated, vulnerable. They won't come out of their homes. So we need to make sure they're getting the adequate care and they're in their health network. So we do home visits. We do workplace visits. We go and talk to employers about NF and its manifestations, so that if there are any issues, they're soon overcome. We also act as experts in things like industrial tribunals in legal cases. And because of, as I said before, research showing that by the time you're into family level 3 with NF, you're in the lowest socioeconomic group, an awful lot of our cohort have to claim benefits. And the benefit system, although it's set up to help people, is not the easiest thing to navigate. So our nurses help people to make sure that they get the right financial and other support that they're due. Okay, we also operate a UK helpline, and that is for everyone. Actually, we take lots of calls from abroad, but it is predominantly for 2 sets of people. Those that don't have a regionally based advisor or nurse. And it is also incredibly important in the period between a tentative diagnosis of NF and actually seeing the consultant for the first time. Because when your GP might say, I might think it's NF1, natural reaction is you go home and you Google it. And that will just send shockwaves through families, because as with everything, it's always the worst things that are on the website. So it's really, really important that my nurses are there to talk to those people with a tentative diagnosis, so that they've got questions to ask. Hopefully they can control some of their fears, help them with them, give them pointers, talk them through what's going to happen, and crucially make sure that does happen, that they do get onto the correct pathway for the condition. So that is a hugely important role for their helpline. On the helpline as well, we also, the two, all of my people are specialist NF nurses, band 7. They are responsible for keeping up to date all our leaflets all the time. So they update them, and then that goes on to the medical advisory board for approval. And we get lots of requests from Europe, around the world, as to whether they can use our leaflets, and I'm always incredibly happy for people to do that. Just talking when Claire and one of the earlier people were talking before about schools, we have 3 levels of literature in particular, which I think is really useful for children. 1, when should I tell my child they have NF? Not every parent wants to tell their child, so we have guidance around that. We have a pamphlet type booklet similar to what you're doing in Portugal, which explains to the child about their NF. But also, I'm a great believer in they've got to be included and not to be made to feel different in school. So we actually have a book that's 3 short stories written by an award-winning children's illustrator and author, and it's all about children, although it's animal form, with NF in various scenarios being accepted as part of the team. And I think that's really important because, you know, when they start school, young children don't think that anyone else is any different unless it's pointed out to them. It's only as you get later on in life that people are judgmental. So if we can crack accessibility when children are small by making it part of a storybook and stories, it will help that child and their classmates throughout the rest of their time in school, and it would just be more accessible. So anyway, one of the biggest things that we do is Project Inform. So we played on the word inform with NF, small I, capital N, capital F-O-R-M. And we inform your school, we inform your employer, we inform your GP, we inform your MP, and we have things to download for all of those people. But the biggest thing we do is our school Project Inform. And we sit down with the parents, the teachers, the SENCO, physios, ATs, mental health teams, sign and language teams, anyone involved in the care of the child. And we sit down as a group, we have a round the table meeting, and we set out an educational plan and other plans that they can follow throughout their time in school. And it's used as a benchmark. And it can be things from as simple as, because of the neurofibromas, the child can't grip a pencil well enough, to other much more complicated psychological issues. But we find it's really important to have these round the table meetings, first and foremost, because if it's not a de novo case, if one of the parents have had an F, it's likely that they've had a really bad experience in school themselves. So sitting the parent down with the school, with all the help, with ourselves, and we'll always be the anchor, brings the parents back on board as well as helping the child. So it's a 2-step approach. And we do an awful lot of that work. A huge amount of work goes on. Schools are sent packs. Now, crucially, we don't go into a school at the request of a parent, because as Claire Barkham mentioned earlier, how do schools react? You've got to get the buy-in of the school for this work to be efficient, because if you don't get the buy-in of the school, you won't get anywhere. So we insist that the school makes the request for the visit, and then the school is sent the pack, and then the the meeting takes place. There's a lot of work done before the meeting, and there's a lot of work done after meeting. And this leads me on to this slide that you're looking at now. And this is where, for as long as I'm at the charity, I will always insist that we have specialist NF nurses to look after people and not community support workers. Because you've got to ask, do you want an expert or do you want a generalist? And if you have a specialist NF nurse, that person who sits down with your child, she knows the patient history. She has specific knowledge of the condition and she will know the family history. She will also have, or he or she, sorry, will also have up-to-date and first-hand knowledge because we are governed by a medical advisory board. Professor Gareth Evans for NF2 and schwannomatosis, Professor Rosalie Ferner for NF1. They do 2 training sessions a year with all my staff. And because of this specialism, they can liaise with associated medical professions. They have the clout to bring people together, to make them listen to them, to make them understand. And then they are able to implement actions and to get the support to deliver those actions. Whereas if we just had a community support worker, which would be an awful lot cheaper and would make my life a lot easier, they can only ever be generalists. I mean, I could go into a school and talk about NF, but I couldn't talk about the specific child because I don't have access to their health records. And it's only if you have specific expert advice that you can truly make a difference to a patient, as far as I'm concerned. You can raise awareness and you can give general advice, but I think this is why I will fight to get specialist nurses. As I say, when I first started, there were 2. We will hopefully by March have 10. I think we need another 7 or 8 in the UK to cover, but I see the work, I see the feedback every day. And I just think it's so important to have expert medical advice on hand. And also, it's a lifetime of support. Yes, you might get some of my nurses move on every now and then. Most of them seem to stay in their post for a long time. So you have a relationship that you work with the child or the adult and you see them through, and you become not just an expert in their medical condition, but in their family background that you were talking about. So it's not just medical, it's emotional and psychological support, as well as helping them with their financials and stuff. It's an all-round experience. Just going on with the extended network covers our website, where we constantly improve it. We had plans to run out a new mental health section, which we were doing at the start of the year, and we hurried it along when the pandemic hit. And we've had lots of praise for about that. We also look at holistic things, doesn't have to be medical. We've got lots of apps on the website, all approved by the NHS, which people can download for helping themselves. We're currently working on designing an app for GPs, so that, because we are still amazed by how many calls we get from GPs. So we're not just there for the patient, we're also there for medics. How many GPs will ring up and say, I learned about NF on a wet Wednesday afternoon in my 3rd year, and that's it, never seen anyone. So we send out clinical guidelines to them, but we're also working on an app for the GPs platform, so that when someone goes into their GPs, the doctor will just be able to type in neurofibromatosis and a whole pile of information will come down to them. We're involved in direct marketing campaigns to all NHS trusts at the moment, various departments there. As I mentioned, we worked on regional information days. Obviously this year it didn't, but we go to a part of the country where there is no nurse. And we also, this has been postponed, but anyone's welcome to join us at it. There's going to be a very large conference at the Royal College of Medicine called Nerve, Tumours and Me, where all the leading experts in the country are going to go and speak at it. So I assume it's going to be online. I will let you know about that. Now, we reach out of the 26,500 with NF in the UK, we reach roughly 15,000. So we're not doing a perfect job. I know not everyone with NF needs our condition, but we're currently working on a strategic plan to see how many more people we can reach in a very cost-effective manner. Obviously, this virtual world has shown us some pointers, but as I said, there's an awful lot of people in the NF cohort that don't have access to online. So we're looking at that at the moment, and we're also carrying on to see who else in the blank part of the UK, those NHS trusts who will work with us to set up some more posts.